Hello and welcome to the Health Show. My name is Sal DiBella and I'm your host. Today, like other days, we've had very interesting doctors come on our show. And today we have another interesting doctor. His name is Dr. Rowen. He is an MD. He has been practicing complementary medicine since 1983. He attended the prestigious Johns Hopkins University School of Medicine. Welcome, Dr. Rowen.
Thank you very much, Sal. That's actually slightly incorrect.
Okay.
I went to Johns Hopkins University undergraduate school, and I went to what some people call the prestigious University of California, San Francisco Medical School.
Oh, okay. I'm glad you corrected me. Now, can you tell our viewers, in 1971 you graduated the School of Medicine. What motivated you in 1983 to start complementary medicine?
Well, I graduated medical school in 1975, and in my third year of medical school, I actually got quite depressed. And it was because I believe in protecting the environment. And I saw what we were doing to patients in medical school as identical to the desecration of the environment. We were filling them with synthetic chemicals. We were poisoning them. We were not getting anywhere with them. We were testing them and testing them, and filling them with chemicals and not curing anything. And that's not why I went to medical school, and I almost quit. But I decided I'm 3 years into it, a lot of money into it, so I might as well finish, and I did. But I just kept an open mind looking for anything that might really help people instead of putting some synthetic petrochemical into it.
I heard you say something about legislation, that it must be in other words, in the United States, where real change has to be made in the medical paradigm. Can you comment on that?
In the late 1980s, one colleague of mine after another was losing their licenses for doing unconventional medicine. They didn't hurt anybody, and in almost every case, they actually helped the patient. They were doing things 30 years ago, or nearly 30 years ago, that now we consider gospel. For example, they were giving vitamin B12 when the level in the blood was okay, and they were finding it worked. They were giving thyroid when the blood test said okay, but they were finding clinically it helped. Well, today we know that this is real. But they lost their licenses then. And I knew that sooner or later it might come and haunt me in Alaska. I was a big fish in a small pond in Alaska, meaning we didn't have that big a population. And I decided if we were going to make progress anywhere, it should be Alaska. And we succeeded the first year trying in getting a bill passed to protect unconventional medicine. And that's been copied in many states across the country now.
Okay, a question I have for you is, what do you think has to happen before alternative treatments could come around in the United States?
Sal, that's a loaded question. In fact, it's an impossible question. And the reason is, medicine in this country is not driven by service to people. It's driven by profit. And you know, if your product is inferior to the next guy's, let's say you're making a car and your car sucks, but you want to survive even though the guy down the street is making a much better product. How do you manage to keep your product ahead of everyone else's? Because it sucks. The only way to do it is to get a government monopoly on what you're doing. So what we have in this country today is not a healthcare system. It is a disease maintenance system where you have corporate interests, multinational corporate interests, who have a monopoly on what is going on in the disease maintenance system to sell their products. There is no interest in finding a cure for anything, because if I came out with a cure for cancer today, say, how are they going to sell their chemotherapy that people have to take for months and years and get all the side effects to sell more products? It is a loaded, upside-down Ponzi scheme that is the greatest Ponzi scheme the world has ever known. And it is these same corporate interests who own the government. So it's essentially going to be impossible unless people wake up and they look at the contributions their elected officials are getting, and if they take one contribution from a pharmaceutical, they vote against that person. They vote against any incumbent, and they start taking a close look at some of the innovative stuff out there and organize and join organizations like the Alliance for Health, there's a lot of organizations out there, Alliance for Natural Medicine, and join them and support them to begin making change, because there is a vested interest in keeping the current failed paradigm. Now, the other way it's going to change is by an absolute financial collapse. But that will affect everything, because the way things are going in this country with the disease maintenance system, we're headed for a catastrophic breakdown of everything. Because more and more money, you're throwing gasoline on the fire in an attempt to keep oxygen out of the fire, drowning it, but you're just throwing more fuel on it. And we're throwing more money at a system that cannot work, because there is, I usually hold up a $100 bill in my hand when I give lectures. And I say to the audience, whether it's medical doctors or lay people, I'll give this to the first one of you who can name me any synthetic petrochemical pharmaceutical that cures a disease. No one can. Not even the doctors can.
Okay. In my book, I have a book which it's called 60 Doctors Talk About the Cure and Prevention of Cancer. And what I talk about in my book is what, in my opinion, what has to happen is that they should make lobbyists, the first thing, lobbyists against the law, to give money to different senators and congressmen and stop giving money. You know, once that's done and that's out of the way, I think there might be a change where there's not money involved. Lobbyists have been around for many, many years, and what they do is promote their product, and they pay, you know, for that product. So that's my opinion. They should get rid of lobbyists and make that against the law. Just like I think I just heard recently, doctors that get favors or get money for treatment like chemotherapy, which a lot of doctors are doing nowadays, and I heard getting it for say $2,500 and selling it for $6,500. You know, that they or favors or money or to push their product. I think that just came up. I heard that online or in the news somewhere. So that has to stop also.
Well, I do have a couple suggestions that are actually practical. The first thing, I'll tell you where things could change. Obamacare, in my opinion, is a calamity, because now you have the corporate interests involved, and they will decide what diseases you're allowed to have and the treatments you're allowed to have to treat the diseases you're allowed to have. And that's all done through coding. That's got to end. That's number one. But I've written several pieces on solutions. One is you eliminate part of the FDA. Now, the FDA has a lot of value. I don't want things out there that are dangerous, but I don't want some bureaucrat in Washington, D.C. telling me what works. I want to determine what works. I'm the doctor, I'm in the office, and I have the responsibility to the patient. If they can tell me that something out there is dangerous, or the danger is greater than the risk, fine, I don't have a problem with that. That's their goal, that's their job. But I'm using things, I might use things that they don't want me to use or off-label or something like that, and they have a hissy fit. So that's the first thing that needs to change. If something is not dangerous, I should be allowed to use it any way I want, number one. Number two, people need to be responsible for themselves. The reason why the system is failing actually goes back to World War II. In World War II, when we had wage and price controls, companies were looking for ways to entice workers. They couldn't pay them more, so they gave them benefits. That was the downfall of what we've got. So now we have a third party paying for your health insurance instead of you being responsible for your health. And people think, oh, I'm getting free health care, or the government's paying for it, or this insurance company's paying for it. Well, by golly, you're the one who's responsible. And if somebody else takes responsibility for it, I don't want to pay for the guy down the street who's smoking, drinking, not practicing good hygiene, etc. That shouldn't be levied on me. He should be responsible, and he pays the price if he doesn't eat right. I'm an organic raw food vegetarian. I eat well. I think you can look at me and you can see health in my face. Mm-hmm. I hiked the John Muir Trail a couple years ago, 200 miles of the highest altitude in the United States as a raw food vegetarian. Very few people can do that. Now, if somebody is eating fast, fried, refined, and processed food, and they're getting diabetes, why should you pay for that? But that's what the system is doing. It wants to level the playing field and have everybody else pay for the indiscretions of certain people. That doesn't promote sanity, and that doesn't promote efficiency. So it's not going to be until people are responsible for themselves. And one way you can do that is through medical savings accounts. With a medical savings account, instead of taxing me to pay for your health care, I can put money into an account that I can use for my health as I see fit. And if I stay healthy and I eat right and I get exercise and I don't use it, then I get rewarded because I could draw some out for personal use. Does that make sense?
Yeah, it makes sense.
That's a reward system. But right now, the reward is somebody else is paying for it. So who gives a damn?
Okay, let's get off the subject a little bit of that and talk a little bit about you and your practice. Now, you have an office in California, is that correct?
Yes.
Okay. Now, what can a cancer patient that comes to your office, what can they expect? I mean, as far as testing and what do you do for them when they come in?
Well, I don't treat cancer per se, Sal.
Okay.
I treat the person.
Right.
And I tell them that right up front. I believe there's three basic causes of disease. It doesn't matter what the problem is. Malnutrition, toxins, and stress. There's a couple other ones, but they're not as important as those three. Genetics is involved, lack of exercise is involved, that's important. Sunlight, among other things. Genetic is generally stimulated by malnutrition, toxins, and stress. It's not the genes that give you cancer, it's what you do to the genes. So no matter what you have, whether it's cancer, rheumatoid arthritis, chronic fatigue, and I see a lot of chronic fatigue and infection, I try to take apart your history like a detective. I want to know about these things. I want to know about your nutritional status from birth to the present, if I can find out. I want to know your toxic history. I want to know your dental history, what poisons are in your teeth, what root canals you have, what operations you have, things that could screw up your body's energy fields. I take I take a really unusual and detailed history on things. And then I try to intervene in your situation based on who you are. You asked the question of cancer. We've had some marvelous results with cancer, which are on my YouTube channel, and we've had some failures with cancer. Generally, the oncologist has nothing but failures with cancer. Mm-hmm. At least we have some successes. So I can't promise anything about cancer except to do the very best that I can and work in the interest of the patient, not in my interest or the interest of pharma.
So the testing that you do you do the chemosensitivity test or anything like that?
I don't use chemo.
No, but the good thing about that is that it will tell you what, when you do that test, what naturally the reason why most doctors, in my opinion, don't do it is because they're going to find out that chemotherapy doesn't work most of the times. But it also tells you what will work, what supplements, what treatments, alternative treatments will work. So that's why, some of the doctors that I interviewed do that type of test, and they do other tests also, blood tests. And so what type of treatments do you have available for some of the people that come in with different types of disease?
Well, I evaluate my patients more with an energy technique. I use kinesiology, muscle testing. It is subjective, I admit it, but that's how I generally evaluate what's best to use. That's number one. Now, you asked about techniques. I would say my number one technique is, across the board, cleaning up your diet. I don't expect you to eat like me. I told you I'm an organic raw food near vegan. I eat some dairy. But I expect you to get close. If you eat like me 70% of the time, and you want to eat meat and eggs and chicken 20%, 30%, I don't care what you do with the remaining 20 or 30%, provided it's not fast fried, refined, or processed. And if you do that, you're going to help your condition dramatically. And I will assist you in doing things like that. We detoxify. That's got to be important. We especially look for heavy metals. Mm-hmm. In stress, I'm a little weak in because I would just as soon send them to somebody who can help them with stress better than I can. In terms of treatments, probably my number one treatment is what we call oxidation therapy. I teach oxidation therapy around the world. I do it at my office. Oxidation therapy includes several different modalities. In the past, it might have included intravenous hydrogen peroxide, which we don't use now because it's hard on veins. You can use high-dose vitamin C. That does work. It's actually an oxidation therapy, but it's also hard on veins. You can use ultraviolet blood irradiation therapy. That was around this country 80 years ago. And my God, 80 years ago this started, and there's ample literature on it, and I wrote an article on it, and it's posted on my website, drrowen.com. You can use ozone therapy. These therapies are amongst the greatest therapies that exist on the planet, in my opinion, and they will treat a broader variety of conditions with greater efficacy and safety than anything else I know that exists in the world. The bottom line in healing is oxygen. Mm-hmm. You have to get oxygen to the cell. I mean, you look at me, oxygen's out here. Oxygen has to come through my airways, down into my lungs, and then it's got to get through my lung lining, into the circulation. My heart has to spread it throughout my body. The red cells have to carry it. The red cells have to release it. Oxygen then has to get across the capillary and into the cell and then burned by the mitochondria. If that doesn't happen, you're going down the tube. You'll either die of infection, heart disease, cancer, something not pleasant. So the most important thing in determining your health and your longevity is how much oxygen you consume. And that's what these therapies are about. They help stimulate better circulation, better blood flow, better oxygen delivery, better oxygen release, and even the improvement of mitochondrial combustion of oxygen to make energy. That is the number one thing that I do. And when you do these therapies, sometimes you have crippled people walking into your office and they walk out swinging their hips. I've had that, and it's on my YouTube channel.
Mm-hmm. Did you ever hear, it's interesting, I spoke to one of the doctors. They give intravenous turmeric, curcumin. Did you ever hear of that before?
Yes, I have.
Okay. And how was that? I'm curious because that's the first time I ever heard that from this doctor. So how do you make it into a liquid form? What do you add to it to go into the bloodstream?
I don't do anything to it. A compounding pharmacist gets pure curcumin, pharmaceutical grade, and he has to suspend it in some type of liquid that it's soluble in for injection.
Okay, so in other words, it's not IV, it's injection?
Well, I don't know. He might be doing it IV if he could get one that's IV. I can't answer that.
Oh, okay.
I've actually had some of these preparations in my office, but I don't have enough experience with it to comment on it.
I'm a big fan of turmeric, curcumin. Most of the doctors I speak to, they're big fans of that also. They include that in their therapy. And I can tell you stories with arthritis, with polyps. It's amazing how it gets rid of polyps, the cancerous type and the non-cancerous type. I've had family members, firsthand I've seen it, after having polyps for 18 years. They just taking 2 capsules a day, boom, it's gone. I mean, a lot of people don't even know that. You know, it's amazing.
Sal, curcumin is a bioflavonoid, and bioflavonoids are a very large part of the nutritional supplements I use. I go back and forth. I use curcumin, I use green tea, I use luteolin, resveratrol. All of these are bioflavonoids, and they all have cross properties. Some seem to be better than others for certain things. For example, silymarin is a liver protector. Bilberry is a retina protector. Green tea crosses the blood-brain barrier. It's got things that cross, and luteolin. So these things all have certain properties that probably are better for certain organs than others, and potentially could be the basis for herbal medicine, why certain herbs are better for certain organs than others. Curcumin is among the top of the list.
And that's the most sought out supplement that people are looking to buy. It's amazing. It's amazing that it's starting to go up in price little by little, more and more. But it works. I've seen it work with arthritis. I've seen it, they're talking about now with dementia, that even I think Dr. Brzezinski was talking about the brain as far as curcumin, the benefits of that. Now, what about glutathione? Do you use that also?
I do use glutathione.
Okay. We had our last show, Dr. Tom Levy. He talked about glutathione and the benefits of glutathione, and you use that for detox and...
I use a lot of glutathione. I use it intravenously and orally.
Okay.
I don't use glutathione itself orally because it's not very effective, but I use things, precursors to glutathione that are cheaper and that I have had good experience with.
What do you think about B17 people taking B17?
If they want to take it, that's fine.
Mm-hmm. Okay.
No comment.
Mm-hmm. Okay. Now, do you have anything you want to share with our viewers in reference to successes that you had, not only with cancer, but any diseases or ailments or?
Well, if you go to my YouTube channel is Robert Rowen, MD, all one word. If you type in Robert Rowen, MD with no spaces and then channel, you'll come to my YouTube channel. And I have well over 100 patients posted on there of them telling their story.
Okay.
I don't expect anybody to believe me because I could have a vested interest, but believe the patient. I have cases on my YouTube channel of MRSA. That's a bad infection. Of MRSA being fixed in 1 or 2 treatments of oxidation therapy. I have people walking into the office who are basically crippled with osteoarthritis of the hip or the knee, and they're essentially living a normal life now. I've had a series of patients with chronic fatigue or chronic infection. Not so many of them are posted, but there are some on there, and they receive treatment, and they're living very happy lives, basically one after another. When you give the body what it needs, that God designed us to need, and you get out of the body what poisons it, you can only expect the body to respond and get better. It basically, this is my feeling, it has to happen. You know, the level of improvement is variable from patient to patient. So we have to keep looking for what else we can do. There are some people who do homeopathy. I'm weak in homeopathy, but I'm not shy to refer out for it. My big forte is oxidation. And it is so huge and it helps so many people that I've largely stuck with that, not to the exclusion of anything else, but I'm certainly willing to share with someone else if I think it's needed. We treat scars because scars could disrupt energy fields, root canals. I've had people who were having chronic intractable pain because of a root canal that was affecting their neck or their low back here. And it's not that they were having pain in their tooth. The tooth was disturbing energy pathways in the body that was having distant effects. So you come into my office, I want to know your dental history, and I get to work on that right away. No, I'm not the dentist, and I'm not going to provide definitive care, but I can probably locate the problem for you. So, you know, how many people do we help? Probably the majority of people who come in will see benefit. We have failures, of course, too. But like I said, if you're really looking at the 3 basic causes of disease and you address them, you should expect results. Mm-hmm. Pharma, on the other hand, gives you chemicals that nature didn't design for the body. They interfere with the body. Let's look at hormones, for example. Pharma isn't interested in natural hormones. It can't make any money on it. So pharma alters it slightly into a molecule that's not found in your body. They can patent it. They make bazillions, and then they find out 20 years later that you get breast cancer from it. Mm-hmm. That's what's happening.
Do you check for iodine in people? We had Dr. Brownstein on, and he's big on iodine. Do you also check for that? And how do you check for it?
I don't bother checking for it.
Oh, no? Okay.
You need to ask me why.
Why?
It's not cost effective, in my opinion. Okay. Almost everybody is deficient. So I recommend iodine for almost everybody. And I recommend a particular dose that I have found very effective. And rather than spend their money on getting testing, I just give them iodine.
Mm-hmm. What about bromine? I have a video that I interviewed a doctor many years ago, about 25 years ago. And he spoke about he found bromine in the body then. And some of the doctors I've interviewed said that when they do the testing, almost everyone has bromine. Do you think that's hurting people?
Yeah, I do think that bromine is a problem. And they add bromine as an anti-caking agent in breads. And yeah, I think it's a problem and it's going to interfere with the thyroid. I agree. Mm-hmm.
Okay. Now, can we talk a little bit about obesity? Because it's amazing how many people that are out there that are obese, and because of that, they get either diabetes or they get other kinds of problems. Can you comment on that?
Yeah, it is amazing. The majority of the American people now are overweight, and a significant minority, like 40% are actually obese. And this is a calamity. The diabetes is epidemic worldwide. And your abdominal fat, the visceral fat that you hold right down here in your belly, is a toxic organ. The more you've got of that, the more inflammation there's going to be in your body. The visceral fat, and if you don't eat right, and that's why I told you I'm an organic raw food near vegan. I don't have to worry about this. People who eat like me don't get fat. They just don't. I'm the same weight as when I graduated high school, believe it or not. 155 to the pound. People who eat a lot of pasta or processed food, there's all these additional calories. The body doesn't know what to do with it, so insulin comes out and it tucks it away as fat in the belly. I call insulin the hormone of aging and death. You can't live without insulin. If you don't have insulin, you have type 1 diabetes. But if you have too much insulin, it's busy tucking all this crap away in your belly, creating inflammation and aging you quickly. Now, this isn't just an obesity problem. It's a fatty acid problem as well. We are eating fried foods, processed foods, oils that are exposed to oxygen that are rancid before it goes in your body. For that reason, I co-authored an interesting book called The PEO Solution. PEO means Parent Essential Oil, PEO Solution. We do not believe in fish oil. Almost all fish oil is rancid on contact. We believe in fatty acids that come from plants. Now, the standard diet that people are eating of cooked foods damages these oils, so people are getting rancid oils right from the get-go, and that's another cause of diabetes. How do I know this? I go to India every couple of years. I'm a clinician. I'm not a scientist. Clinicians observe. My wife and I go to India. We do Seva in a charitable hospital, and they have an epidemic of diabetes and young people in their 30s losing their legs from diabetes. And these people are peasants, skinnier than me. How on earth are they getting diabetes and losing their limbs when in our country it's obesity that's doing it? So clearly it's not totally a calorie problem. Yes, in our country it is a calorie problem, but in India, I thought about it overnight. How is it that I'm seeing this? And what came to me was the Indian culture, they cook their food to oblivion in oil. They literally boil their food in oil. So they're getting very toxic fats in their body, which is scarring their blood vessels and causing problems. This is another reason I endorse what I call the living foods diet. I coined the term the living foods diet. If you eat cooked food, you're eating food that's three-dimensional. If you eat cooked food, the three-dimensional structure of that food is altered into a form not found in nature. The fats and oils could be oxidized, very toxic. The proteins could get altered in something called Maillard reactions, which turn the proteins into compounds totally foreign to our body and can cause cancer and other conditions. So diabetes and obesity is part of the equation. It's fixable. Mm-hmm. It's virtually 100% fixable. I said virtually in this country. If you start eating the way I'm talking about right now, your diabetes problem should be gone in short order.
I agree with you 100%. Matter of fact, I have another book out there on Amazon that's called Doctors Talk About How to Reverse Diabetes. And how they do that is what you just said. It's what they put in their mouth and what they eat. And they show you, it's amazing, if you go on this diet, naturally you're going to lose weight, but not only that, you're going to cure yourself of not only that, but almost anything. Because, you know, years ago, we were told, I don't know, I'm probably a little older than you, we were told that the immune system is in your bone marrow, it's over here, it's over there. But you know what? After doing the research and finding out, your immune system really is in your gut, you know? And it's what you put in your mouth that determines. And not only what you put in your mouth, I'm talking about not only food, but medicine. That's another thing that's going to kill you also, or give you other diseases or other problems. Would you agree?
There's an old saying, let thy food be thy medicine, and thy medicine be thy food. Mm-hmm. Sal, I beat my patients over the head with a wet noodle to clean up their diet. I bring my lunch into the office, and I let them see what I'm eating. We often bring a smoothie for breakfast into work, too, that we make at home. And when you make these changes with diet, you begin changing everything. And you know the problem of gluten, right? Mm-hmm. Everybody does now. Gluten can really screw you up. Well, if you eat the kind of diet I'm talking about, gluten is not an issue. You get gluten in processed food. Who the hell is going to eat wheat berries? They're not. You're going to get gluten, and if you sprout the wheat or you sprout the grain into a vegetable, you don't have gluten anymore. So sprouting eliminates the gluten. So if you eat a living foods diet, there's no gluten problem. Mm-hmm. What animal in nature is stupid enough to cook its food? I don't see a lion killing an antelope and roasting it over a grill. And the lion is smart enough to eat the guts first, not the muscle, the flesh. That's hard to digest, and it doesn't have good nutrients. The lion goes for the innards, the liver, and the other stuff first. Only humans are stupid enough to eat the flesh first and cook it so that it becomes even more indigestible.
You know, one thing in my life, I'm pretty healthy myself for being in my 70s, okay? And one thing that I've done many years ago that a doctor told me to do because I had a little bit high cholesterol is to take an aspirin a day. So I've been taking an aspirin a day. It has to be over 30 years. Then I don't eat meat. I haven't eaten meat forever. Then another thing I don't do is I don't drink tap water, because tap water has so many chemicals in it, it's unbelievable. I do juicing now. Since I did the research, I started doing juicing a lot more. Am I a vegan? Not all the time, no. But I do watch what I put in my mouth. And what I cut years ago, and which is benefiting me today, is sugar. I used to have, many years ago, my father used to make me coffee before, I went out. He used to make it light and sweet. He loved sugar. I, through the years, started to do, got used to the sugar and kept it up. But when I found that the sugar is the culprit in a lot of problems that people have, I stopped using sugar, the table sugar. I might cheat a little bit. I have pasta and things like that, but I don't have that big plate anymore that I used to have years ago. So and then I take a lot of supplements besides that. So what I think in my life, what helped me is what I cut out. And unfortunately, I don't exercise as much as I should because I have a back problem, which hopefully I'm going to take care of in a few weeks.
Sal, you should look into a treatment called Prolozone for your back.
Okay.
Prolozone. Go to my YouTube channel that I told you about and listen to what the patients have to say. I have a whole series on backs. You will see people coming into the office crippled, and the glee in their face either that day or within a couple weeks with the treatments that you can do to fix the problem at the source.
Okay, now I have severe spinal stenosis.
That's fine. Go to my YouTube channel.
Is that right? Is that right? So tell me a little bit about this medication. How often do you take it and what is it? I mean, not what is it, but how often do you take it and where do you get it?
It's not a medication.
Okay.
It's an injection of ozone oxygen gas. And it gets injected by someone who knows what he's doing, who's well trained at the right location. And the results for arthritis, osteoarthritis, even spinal stenosis are sometimes stunning.
Okay, that's news to me, and I'm sure a lot of viewers out there heard this for the first time also.
That's why you need to go to my YouTube channel.
Right, okay. So
my YouTube channel features these things. This is the treatment that is one of the most stunning remedies for pain I've ever seen. Sal, I write very few prescriptions for pain. Mm-hmm. If I write, there's one woman who has chronic intractable pain because of a motor vehicle accident, and the doctors butchered her surgically. She's my main pain patient who gets drugs because she was butchered. But for the average patient with osteoarthritis, joint pains, aches, headaches, etc., we go for the cause. That's why I take the history that I do. And when you treat the cause and you get oxygen into the area and ozone and you reduce the inflammation, you fix the problem. It's fixed.
Okay.
Now, in some cases, like with knees, we get an 85% response rate. 85%. So we're not 100%. How long does it last? Well, some patients come back to me 3 years later saying, you know, doc, I got a twinge. I want to tune up. Some patients have to come back every 3 to 4 months. But that's better than a knee replacement.
Okay, sure.
You need to see these videos on my YouTube channel.
Now, how would someone get to your YouTube channel again?
The website is www.youtube.com/user/Robert Rowen MD. My last name is Rowen. So again, youtube.com/user/Robert Rowen MD. That's how you get to it.
Okay. Now, have you treat people with emphysema, bronchitis, and the beginning of emphysema? Have you treated people, and what have you done for them?
We generally treat that with oxidation therapy intravenously, and we give them nebulizers that might contain glutathione and or hydrogen peroxide. And we give them nutritional supplements, clean up their diet, get the heavy metals out of them. Emphysema is not easy. There's already destruction. Our goal is to slow down the continuing destruction. We can't bring back dead tissue. Now, maybe stem cells can, and I don't do stem cells. But short of stem cells, our goal is to try to slow down or stop the destruction.
Okay. Now, can we get back a little bit more with the sugar and what else it harms in your body other than, being overweight, and what other things does it hurt?
The amount of sugar in one soft drink is enough to, if you drink it, it is enough to suppress the ability of your white blood cells to eat bacteria by 50%. And it takes 6 hours for them to recover. Hello.
Yeah. Mm-hmm.
If that's doing that to your white blood cells, it's impairing every single cell of your body.
Mm-hmm. Well, on the other hand, I have people say, well, I don't have that. I use aspartame in the, in other words, they use the soda with the aspartame in it. And I say, that's probably hurting you worse.
It probably is worse. And there are studies out there now that are showing that it's worse.
Right, right.
You actually have bigger problems if you use the chemical sweeteners.
Mm-hmm. Right, right. So I stay away from all of that. What I've been drinking lately, which I tell you the truth has been energizing me and making me feel so much better all around my whole body, is carrot juice. I've been drinking more and more of organic carrot juice. And I drink maybe 3 or 4 glasses a day. And it's amazing, you know, how that helps your body feel better. You know, it's the first time I did it. I did it about a week ago. I started. And I could see results right away. It's amazing.
That's because it's a living food, Sal. It's alive.
Right.
Now, I don't do a lot of juicing. I do recommend certain juicing for cancer patients specifically. But I believe that it's a good idea to get the whole food. Because if you're going to drink nothing but carrot juice, which carrot juice has a lot of nutrients, and you don't get the fiber with it, now you're going to get a slug of sugar from the carrots, and that could have some counterbalancing properties to the beneficial properties. Whereas if you eat the whole carrot, or at least blend it, then you're getting the fiber to slow the absorption of the natural sugars. Am I making sense?
Yes, yes, absolutely.
You're much better off eating a whole orange than drinking even fresh squeezed orange juice. Mm-hmm. Much better off.
Mm-hmm. Okay, is there anything that you want to cover that we didn't cover, or say, whatever? You know, we're coming close to an hour, so I'm going to give you that choice of whatever you want to say.
Well, we're going to close on the topic of chelation therapy. We live in a generation of people who are poisoned by heavy metals, both from mercury in your fillings and industrial lead. All of us have it. Guys like me were scorned and castigated for years, saying chelation therapy is scam. And now we have articles coming out showing that chelation therapy really does improve circulation, and especially in diabetics. So heavy metals is one of the things I look for in terms of toxicity. Other ways to detox might be saunas and sweats, dry brush massage, colon therapy, and oxidation therapy helps to detox. So once again, I'm trying to work within the wisdom of the body. I believe in God very strongly. I believe it, and if you don't believe in God, fine, look at nature. What did nature design for human beings to eat? What did nature put away over there? The poisons, so that we don't get it in our body, that we're now getting in our body because of the corporations. And the stresses in our life that are brought upon us by government, by corporations, by everything else. So this is where we need to look if we're going to try to have a modicum of health. It's a miracle to me that human beings are living as long as they are, and in the degree of moderate disease that they have, because if you did this to animals, what we're doing to ourselves, they would be dead quick. So clearly we're different than animals, but we're not that different that we can survive what we're doing to ourselves. And that's how I'm going to close your show.
Okay, now if someone wanted to get in touch with you to come, that lives in California, that wants to come to you as a patient, how would they do that?
They can call the office, 707-578-7787. 707-578-7787. Or they could send an email to the office. The email is in my wife's name, Terry Sue, TERRISU, at sonic.net. That's the office email address. She's a physician.
Right. And you're in California. What part of California?
Santa Rosa, California, an hour north of San Francisco.
Mm-hmm. Okay. I want to thank you for being on the Health Show. And I'm sure we gave a lot of good information out there. And that's what we do. We try and do that every week.
Thank you for having me, Sal.
You're quite welcome. And maybe we'll do this again some other time.
Thanks. Have a good day.
Thank you. So there you have it. Dr. Rowen talking about what people should be doing to stay healthy. And I want to thank you for joining us on the Health Show. And hopefully we'll see you again the next time.